And this is a female Squalus sulci. You can tell because she doesn't have claspers. The males are going to be smaller, sexual dimorphism. For many animals, it doesn't work the way it does for mammals. Mammals, the males are larger than the females, as you can tell by seeing Amanda and myself next to each other. But for many other animals, the females are larger. It all depends on reproductive strategies, but I'm not getting paid to tell you that yet. Let's take a look at some of the features we have before we cut into this. So these little black dots here, we're going to talk about those in the lecture this week. Those are the ampullae of Lorenzini. These allow for electroception. Obviously this is a female because she doesn't have claspers. But one of the things you'll notice is the projection here. If she was pregnant and close to term, since this species gives birth to live young, she might have undergone what's called a spontaneous abortion. Basically, live-bearing elazobranchs, if the babies are close to term, will release the babies when they're under stress from a predator. No one knows why that is. I'm sorry, you're going to hear this in lecture tomorrow. No one knows why this is. It may be that they're giving the baby a chance to escape, or it might be eat my baby and let me go. Or it could be the plume of blood with the discharge of the baby, like an octopus ink plume, helps with concealment. No one really knows. One of the other things we can see here is how the tail was cut. And there we can see the vertebra, hemoarch, neural arch, centrum. We can see the horizontal scalagena septum dividing up our epaxils and hypaxils, which we're going to be looking at here. All right, so what are you going to be skinning on your animal? You're not going to skin the whole animal, which is good because this takes a long time to skin these sharks. They're going to be much harder than the rats were because of the denticles or placoid scales. We're really focused on between here and the edge of the mouth for the ventral animal, not the whole length. Because when you think about it, what are we going to be seeing once we get here? Hypaxial muscles, myomeres, myosepta. This portion is going to look the same as this portion, it's going to look the same as that portion. So having you skin the whole thing is just busy work. We're also going to be skinning the fins, and actually this kind of works out well. For most of these animals, you'll see a color difference where the muscle ends. So this part here is the only part where we see muscle. All of this is muscle free. So you only need to skin the pale part. All right? The pectoral depressor is going to look the same as the pelvic depressor. So there's no point in skinning the pelvic depressor. So you're just going to be working in this area on the ventral surface. Oh, one other thing, you'll notice staples in here. These staples are where they open the animal up so they can inject latex into the blood vessels and preserve it. With a larger animal, you can't just soak it in preservative and expect it to pick up preservative. You have to open the animal up. All right, so on this side, we're going to work from right in front of the spiracles to somewhere a little behind the dorsal, the pectoral fin, for the same reason. And once we get beyond here, it's all repetitious. We can also see here the lateral line, which happens to sit above the horizontal scalagena septum. The lateral line we'll talk about in the lecture tomorrow, but we talked a bit about that yesterday with the posterior and anterior lateral line cranial nerves. All right, so you're going to skin dorsal, ventral. You're going to skin towards the ventral from the dorsal. We're going to start dorsal. That's the easier place for you to start. We're not going to see a nice color difference here, but you can see where you would stop skinning the fin pretty easily. Where you're going to have trouble is right here. So the skin is going to become closer and closer to the gills. It's going to get really tight on that. So you're going to go from dorsal towards the gills, ventral, and have to stop at one point so you don't damage the gills. And then you're going to come from the underside and work your way on the gills. And you feel, oh, I'll be able to finish it off this way. But no, more likely than not, you're going to end up getting stuck with a little strip of skin right along the midline here because you just can't get that off without damaging the gills. And that's perfectly fine because we can still see all the muscles and everything. All right? So, the good news about this, once you skin it, you're almost done. There's no fat layer. There's no fascia to remove. The bad news is the muscle's really, really tightly associated with the skin. So you gotta be careful so you don't fray it, so you don't make it look like flaky white fish on a mixed fish. All right, so coming in, initially, you use your fine-tooth tissue forceps. Try to find a place to get into, and you're gonna hear scraping sounds, because that's the tines against the bony dermal armor. Well, I got a rat hair on this. Actually, a pretty long rat hair. I think that's a Jacob hair. So you want to be very careful as you come in here. Come in pretty shallow. Try to find an area where you can get a little bit of a fold to give you a little room. There we go. I actually might have gone a teeny bit deep on that. That's how close this all is. There we go. And then once we get that, do the same thing as we did on the rat skin. 45-degree angle. 90 degree the opposite way. Hit those corners hard to expand it. Keep the forcep hand moving. But what you're soon going to find is that this is really tough to work on. So you're going to want to move to the large tooth tissue forceps. Now another thing we can see here is, alright, as we look in here, you can see the muscle. It's kind of a yellowish color, like candy corn, which is actually where candy corn comes from. Most people don't know that. And as you can see, I'm working along here, you can see that nice orangish yellow color coming off, right? But over here, it's white. So if this is where it's so difficult. If you don't use enough tension, you'll get a little bit of the dermis left on top of the muscle, which then you're gonna have to go and clean off. And you don't wanna have to do that because it's really tough to get up. So if you're not using the right amount of tension, it's gonna fray on if you use too much. If you use a little too little, it's gonna look like when you're peeling an orange and you get that white film left on the orange segments. So you gotta really, really be careful. And see, when you see a piece of muscle coming up like this, you just come up a little higher and lay it back down. Just like we did with the rats. Your hands are gonna be tired at the end of lab today from working on the shark. That's just the way it is. But already we can begin to see myosepta and myomeres. Okay? That's what you'll be working on when you get to that.